Hello, this is me, Renata, talking with Renata, show host. And today, our this week's episode is going to be dedicated to differently wired children, whatever that means. Children who come to this world different. They are not better, they are not worse, they are just different. And no matter the label that we put on them, they might be called autistic, they might be called ADHD, they might be called sensitive or gifted children. They are all in some way a gift to all of us around them because they make us see the world differently. So today, in our today's episode, we're going to talk about ADHD and what does that mean and how those kids are a gift for us. Everyone who are in touch with them, who raise them, who live with them. And for that, we have a very special guest today, which I'm going to introduce to you in just a couple of minutes. Hello, everyone. I'm so excited to be here today with our very special this week's guest, Brooke Schnittman. She's an owner and founder of Coaching with Brooke company, which offers coaching program for families. She's also an expert in the field of ADHD management and support for families. She's a public speaker, and she's the one who accepted so kindly to talk with us today about ADHD, which is still here, a very undiscovered topic. And we don't talk about it very much in Lithuania, and we still don't know what that really means. And is that an excuse for all those kids that get in trouble? So now we can say, they are not really trouble because they are ADHD. What does that even mean? I remember growing when I was at school, when I was in primary school, there are always those boys, who were trouble. And nowadays, so people ask, so are we going to excuse their behavior? Because now we say that it's ADHD and that's okay. So I'm just, trying to prepare for the context.
Yeah.
And so first of all, thank you for being here. I'm very grateful for you to be here and to discuss about all those things with me.
Thank you for having me. I really appreciate it. And it's amazing that you are pushing this knowledge out there, because you're right. Even with all of the new advancements with ADHD and all the information on social media now, it still is biased in many countries and not spoken about. So thank you for spreading the message.
How did you discover ADHD? Why do you care about it?
Why do I care about it? That's a great question. So weirdly enough, I didn't know I had ADHD until I was 35. I'm 39 now. And I've been working with individuals with ADHD since 2006, actually even before that, but directly with ADHD. And I was a special education teacher in the public school system in New York. I graduated with my master's in students with disabilities, which is special education. I had my undergrad in elementary education. And I then became an assistant director of special education. And I still didn't realize as an adult that I had ADHD. But I always cared about individuals with ADHD. I had that empathy for them, and I wanted them to succeed and level the playing fields for individuals with ADHD, learning disabilities, anxiety, all these other things, autism. So I noticed that the individuals with ADHD, they were really smart, a lot of them, or, average IQ, but they were just misunderstood. And there wasn't enough education out there with administrators, with general education teachers, with parents to really understand their children. People wanted to understand, but they just didn't really get it because they didn't have the education behind it. So I felt like when I was in the school system working directly with the students, I was able to make a huge difference because of that shared empathy and leveling the playing field, where I was giving them the accommodations and the type of teaching that worked for their learning styles. And with that being said, it was a joint effort. So we would talk with the psychiatrist, the psychologist, the social worker, any other people on their team. And that's how the child ultimately succeeded and felt more confident because they got a fair chance. So you had mentioned, is ADHD an excuse? No, it's not an excuse. It's not an excuse for anyone to act poorly. It might be an explanation, but you can't show up a certain way in life and expect to be successful and expect to live in a neurodiverse and neurotypical world, behaving in a way that isn't conducive. So, of course, with the ADHD diagnosis, we need to understand how we can treat ourselves behaviorally and possibly medically, and really do what's best for us to thrive in the world. So that's why I really enjoyed getting to help ADHDers. I think it was just something innate in me that deep down subconsciously knew that I was like them, and I just wanted to help. So
It's really interesting that you worked for so many years with people having ADHD and you never ever like said like, wait a minute, I have it too. So I guess it explains why it takes a long time for parents to realize maybe that, okay, I guess my kid has something. I don't even know what it is, but because we might not notice it, right?
exactly. And so, correct. So, with more information becomes more awareness. But back in the day, there wasn't so much information about ADHD. So I believe that now teachers are more aware of it and they're seeing it in children more often, where before it would have been undiagnosed. And very often parents come to me for coaching because they say, oh, wait, my child just got diagnosed. I'm exhibiting a lot of the same symptoms. Let me check out to see if I have ADHD as well. And they get the diagnosis. So that's more and more, it's happening more and more, which is wonderful that people are really getting to understand their brain and how they're showing up for themselves and how they want to show up for others.
So what's happening in the brain? So how do we get this ADHD? Is it a malfunction of the brain that we get when we are born? Does it happen later in life? How do we attract it?
Yes, good question. So science says it's very genetic. So I was talking to Dr. Amen the other day on my podcast, and he made a joke that if he sees a child with ADHD and their parent doesn't have it, they must be adopted. Where did you get that child from? But it's extremely genetic. Now, there's other things, other factors that can contribute to ADHD. Dr. Hallowell in his book, ADHD 2.0, talks about environmental factors. So toxins, metals, obesity in the mother when she's pregnant, alcohol, drugs, smoking, all of those things. So it's nature and nurture. And there's also epigenetics. So you're born with these genes and they can exacerbate over time or not. So there's also some undiscovered or unproven ideas out there, such as waves from microwaves and TVs and phone signals. But what I can tell you that does not cause ADHD is social media, TV, all of those things that might shorten our attention span. It does not cause ADHD.
That's good news. So we can continue doing that. That's
Yes, exactly.
that's good news.
And very often we need it, right, to calm down after a very sensory overloaded day.
Okay, so now what we know, how do we get it? So it's probably genetic. In most cases, it's genetic. What I mean, if a child, so one of the symptoms is having trouble to stay still, let's say in classroom,
Mhm,
always being on the move and always fidgeting,
mhm,
going places. So
mhm,
if I have a child in a classroom that does that and he's not
mhm,
diagnosed, so there is no diagnosis of ADHD, I might just think that, he's an active kid. I mean,
mhm.
you know, lots of them are having trouble to stay still at school. That's normal. They
Sure.
are, especially boys. So how do I go from there to there? How do we know, that it's just normal will to move or just something more?
Yeah, sure. So that is only one symptom that might or might not exist in someone with ADHD. So that's a very hyperactive, outward hyperactive symptom. Sometimes hyperactivity is not seen, but it's in the brain where we have these racing thoughts. And that very often happens in women and girls. So not everyone who can't sit still has ADHD. We know that. So, in order to be diagnosed with ADHD before the age of 12, you need to have 6 out of 9 symptoms that are given in the DSM 5, which is the diagnostic criteria for psychologists and therapists to diagnose disorders. So, for ADHD, you need 6 out of 9 of the symptoms for inattentive ADHD or hyperactive ADHD, hyperactive impulsive, or a combination of both. After 12, you after 17 actually, you um only need 5 out of the 9 symptoms, but you have to have exhibited those symptoms for at least 6 months and as an adult before the age of 12, and it has to be showing in 2 or more areas of your life.
Okay.
So it's not just one thing. So some people can be disorganized. Some people can be, you know, fidgeting out of their seat, right? People can uh, procrastinate, and they might exhibit that at some points of their life, but it doesn't mean that they have ADHD. They might have an executive dysfunction in one of their executive functions. Doesn't mean that they qualify for an ADHD diagnosis.
Okay. So let's say we take this test and we are positive and we know that we have this ADHD. Um, Now what? How do we live with it? I mean, do we have to change something? Is there anything to treat in there? Do we just adapt to it, and how?
Yeah. Well, it depends on the goal of the person or the parents. So if you just want to know if you have ADHD and you take, you get tested through a medical professional or someone who can test ADHD, then fine. Maybe you find out information from support groups or online, or you just feel more accepted, right? Some people actually want to treat their ADHD. So for those people, I always suggest try to start off behaviorally managing the symptoms. So get coaching or therapy or, read information that you can work towards, get a mentor, join a support group, all of those things. And then as you're treating the symptoms behaviorally, if you decide that you also want to treat it with medication, go see a psychiatrist or a nurse practitioner, or your general doctor if you're a child, and see if you react well to medication. So 70 to 80% of people do actually their body works well with stimulants. 20 to 30% do not.
So we can't really get rid of it, right?
No,
We can
it
just,
doesn't go away.
yeah, we can just lessen the symptoms and manage to live with it. So we make our life easier, but it stays in there.
It's a neurological disorder. It stays in there. You can strengthen your prefrontal cortex because of neuroplasticity. But what happens with ADHD and in any brain-based disorder is that if you don't focus on growing your brain, then it can atrophy. So you have to keep working towards it. It's a lifelong thing. So you can gain the tools to help you feel more confident in your day in whichever areas you want to be more confident in. If you want to be more confident in the way that you think about yourself, or in being more productive, or getting out of the house on time, or, initiating socially, you can learn all those tools, but you also have to make it a habit, and you have to continue to work towards those things. So you're never going to be 100% cured of
Mm.
ADHD. You can definitely treat the symptoms and lessen by managing it.
Can we go through some of those tools that would help ADHD children, let's say, to cope in their daily lives? What's the most difficult for them?
Yeah, absolutely. So I think that it's really important that parents get knowledge to help their children too. So it is a collaborative relationship. So it starts at home, and it also they spend a lot of time at school. But it's a team approach. It's not just that the child needs to do X, Y, and Z. We need to be a unit. And I know it's hard because we're struggling with some of the aftermath of the behaviors. And very often we have ADHD too. So if we're not managed, how are we going to manage our kids? So it's really important that parents get education about how to manage their children, and also how to collaborate with them, and collaboratively problem solve with them, as Ross Green speaks about. And also work together to design systems that work for them. So it's not a top down approach. It's how can you work together so they can have some buy in, and they can be a part of the learning process. So there's that, the parent education. Then the child also needs supportive teachers and support staff that understands their unique brain wiring. Perhaps they need an executive function coach, whether it be in the school or out of the school, to help them maximize their executive functions. Because even though parent education is great and collaborative problem solving is great, sometimes the child doesn't really want you as a parent to be working on managing their symptoms, right? I had difficulty growing up in some of my math classes. My mom was a math teacher. Guess what? I got a math tutor. I didn't want to work with her because she was my mom. And it would impact our relationship. So very often we get asked by the parent to coach the child, because the child responds better to someone who isn't a family member. So get that executive function training. Sometimes socially, you might need some social skills training. There's lots of different approaches. Sometimes you need the medical route. So speaking to a doctor, like a psychiatrist and neuropractitioner, or general doctor, to see if it could be treated medically. Also diet, sleep, all the basics, all of those completely impact our ability to focus on a daily basis. The Maslow's hierarchy of needs are huge.
It so resonated with me, this math thing, because my mom was a music teacher, and I never ever played any instrument until very recently when I hired a music teacher.
Yes.
That's so true. I mean, kids would take easily things coming from outside than from us parents, because we have this emotional connection, which makes it easier, and also it makes it more difficult, because then we get more frustrated more easily, and we get angry, and it's easier with someone who's coming from the outside.
Absolutely. It is. You take the emotions out of it, and then you can have that loving, supportive relationship with your child in other areas. So one of my children have ADHD. I hired actually one of my coaches to work with him because it just helps our relationship.
What if the school doesn't have any of it? I mean,
Yeah. So that's a great question. So the school might not have any of it. So if it's a private school that you're going to, they are not required to help in any fashion. They don't have to by law. So sometimes public schools might be better for someone with ADHD, because they do have to follow the individual education program, which is the IEP, or the 504, which is an accommodation plan by law. If the public school does not offer those services or accommodations, then they legally are required to provide those services outside of the school day, so the service provider can come to the child's home, or they can come to the school after school.
What can we do as parents at home? I don't know. How does that look, negotiating cleaning a room with a child who has ADHD, let's say? Or does that look any different from the way I would do it with, uh,
Yourself
another child? Yeah.
or
Yeah.
another child? Yeah, I would, there's a lot of concerns that we have as parents, right? And I would say figure out what the biggest concern is and why that's a concern. So we can't micromanage everything, unfortunately, with our children. So I remember growing up with undiagnosed ADHD, I had mounds of clothing on my floor to the point where we got robbed. And they did not rob my room, because there must have been two robbers, and one probably thought, okay, we already got rid of everything in that room. There were mounds of clothing on the floor. My mom would step over them to go to my bed and yeah, put me to bed. Anyway, if that wasn't a sign I had ADHD, I don't know what is. But regardless, you have to pick your battles. You have to figure out what's the most important thing. And also the child needs to have their own space, right? They have to have that independence and freedom to be who they are and what they want to be. So if they are very messy in their room, shut the door, shut the closet, right? We can't control everything. Think about what the most important thing is that you want to work collaboratively with your child, and then sit down and meet with them and have a conversation where they are just as involved in the conversation and the plan along with it. So very often you'll do a checklist. We don't want to overwhelm the checklist. I would say maximum 4 things, but the child needs to be involved in creating that checklist so that they have buy-in. I would also I mentioned him before, YouTube, Ross Green. He has some really good ways of how you can collaboratively problem solve with your child. And I do believe in rewards. I know not everyone believes in rewards, but I do, because individuals with ADHD, we have so many negative messages in one day, more so than someone who does not have ADHD and is neurotypical, that we thrive on positive messages. So if we do something that we've worked really hard to do, I really believe in the reward of positive messages after that.
How do we talk about that with our children? About them having this brain dysfunction? How do we present it, and what do we say?
That's a really hard question. So some people don't want to say anything. Some people do want to say something. I think it's important to say something to your child, because if you don't, then they can grow up thinking that there's something wrong with them and they have no control over it. And they're just, lazy, unmotivated, whatever the negative messages that they're receiving are. But when you say something to them, it helps them understand what their brain is all about, and that they have the ability to, help themselves and with the right support. So it's very individualized. You have to know your child, right? But I would start off, depending on the age, by sharing, how this happens when you do this, or this happens when you do this. Well, there's something called ADHD. And, it can sometimes make it harder for you to do things, but it can also be a superpower. And this is what it looks like in a very basic form, right? So for you, you might struggle with X, Y, and Z. And because you have ADHD, we can do X, Y, and Z to fix it. So that's the good news. And you can thrive with it. And you know who else has ADHD? Serena Williams, Simone Biles, Justin Timberlake. So think of the celebrities that they love. Michael Jordan. You can be whoever you want with it, but your brain works differently. So we have to try things in a different way. And I'm here to support you and help you.
So we have to present it not as a trouble in their life. Obviously, that has some sides of it that might seem as trouble, but also to show the side of that being somehow a gift, because seeing world differently, it's a gift. Like everyone else sees it the same way. So everyone seeing it differently. That means that I'm, I don't know, more creative. Maybe I have more insight into what's happening because I see differently. And then knowing all those people that manage to live their lives fully, having ADHD, it also helps because I have an example and I know that then I can do it too. I mean, I can live my life too. That doesn't prevent me from living my life.
Absolutely. It does not. And I also think that it's important for the parent to say, this has nothing to do with how smart you are because you're very smart, or, it has nothing to do with that. It's just, we have to learn a little bit differently. And you know what? Everyone has strengths and weaknesses, whether or not they have ADHD, and we all need to learn differently. And this is the way that you learn right now. And I'm really excited that we're able to discover that now and work with it.
Can we go through strengths of having ADHD? Have you discovered yourself maybe some, good sides and strengths of having ADHD? Maybe at the beginning it was like, oh my gosh, it's really hard and it sucks. And then you were like, oh, but this is also good.
Yes, for sure. So if you guys have been watching from the beginning, I'm sure you see that my video is a little different right now because we had some technical issues with Wi-Fi. And it's a perfect segue into what you're saying because we are really good problem solvers. If you think of like the hunters and the slayers back in like primal stages, we are able to get to the root of a problem very quickly. So that is one thing that I would say that many ADHDers do well on, problem solving, when they're not very emotional about things. We can be very creative. So some of the most creative artists and singers and actors have ADHD, inventors. We can have a lot of empathy and intuition. So as long as we follow our intuition and use it, it's great. But very often we question ourselves and the way that we're thinking. So we don't actually follow our intuition, but we have very strong sense of intuition. We also know when things aren't right. So this justice sensitivity of making things right, that's why you often see ADHDers as lawyers or people who are in the helping service. So teachers, doctors, people spreading empowering message. So we do have that as well. We can also have an amazing ability to hyperfocus as long as that's managed in a good way. We could also be funny, spontaneous. So there's a lot of wonderful qualities about ADHD. But again, they need to be harnessed in a way that allows you to feel good about yourself. So then you can thrive with your ADHD.
How you help parents? Because for children having ADHD, well, that's the way they know themselves their whole life, maybe, and that might somehow be okay. But for parents who discover that, their children have ADHD or have autism or have any other symptom, it's quite a shock at the beginning. I mean, it sounds like the end of the world. And how do you help parents to make peace with it? How do you show them that, life continues and nothing really bad happened?
Yeah, I think it's parent education. And we offer parent coaching because, as I was talking about in the beginning, in order to help the student, you also need to help the parents because we're a team. So the parent needs to have the information necessary to support themselves first, and then also support their kids, because we are so emotionally tied into the well-being of our children that we often give up ourselves. And if we're constantly in that state of giving up ourselves for our kids, then it can come off to the children as emotional or reactive. So we really do need to take care of ourselves. And we also need to learn how to collaboratively solve problems with our children and create systems that work with them.
You mentioned before that, so you have ADHD and your child has it.
Mm-hmm.
What's the most difficult for you in that relationship to your child?
My husband has ADHD and my two stepchildren have ADHD. So the most difficult thing I would say, so the younger child with ADHD exhibits his symptoms a little differently than mine. The older one exhibits his symptoms very similar to mine. So the younger one, he's extremely hyperactive. So I'm navigating a hard line with letting him be a kid and letting him be free and not worrying about the small stuff, worrying about the important stuff. But I also am a step parent. So it's a very fine line on, what I have authority to say and do. So I'm navigating a bunch of different things right now. So it's tricky. But I would say one of the biggest things is, he doesn't pick up after himself. He, came home from soccer camp yesterday and jumped into the baby's play area with all of his dirty clothes. I wanted to say something so bad. Luckily, his father ended up saying something. But I have the authority to say something like that because it's for the health of our baby. But I think that with individuals with ADHD and children with ADHD, they very often need to know why something is being said, not necessarily what. So you can tell them you want to do something and they might say why, and you might take it as a disrespectful sign, like don't question my authority. But at the same time, they legitimately just don't understand why you're saying that. So obviously you're the parent and what you say goes, and sometimes there's going to be no why. It's going to be because I said so. But other times you might just want to say, like, if I had to go back to yesterday's situation, I would say, hey, you don't want your sister to be sick, do you? You love your sister very much, right? Like, so you start with the empathy. Yeah, of course, I love her. Well, you were just at camp with 100 other kids. You have germs all over you and dirt. So if you play with her right now, she's likely going to get those germs and get sick. Oh, so now we understand. So what I need you to do is go take a shower before you play with her, if you want to play with her. Okay? So I need you to get up and leave her play area and go take a shower. And very often surprises are not something that individuals with ADHD can deal with. So they need some sort of transition. So like something like that, you can't really transition them well. But if you want to get them out the door in the morning or go to sleep at night, give them a 10-minute warning, 5-minute warning. Okay, you've had your warning. Now it's time.
I want to ask you something. So I listened to an interview with Dr. Gabor Mate when he was talking about ADHD and autism being a genetic disorder, but he emphasized that that's not a biologically transmitted one. And the way he explains it is that through our behavior as parents, we have ADHD. The way he explained his own story, that we transmit to our children because we cope poorly with what's happening around us, like let's say with tension or with all other emotions. And when we
People
transmit it to our children, but through our behavior, not through our genes. What do you think about it?
What do I think about that? So I had him on my podcast and he was talking about that as well. And look, I think that some ADHD is from trauma, but not all. So to say that every child has ADHD because of the trauma that they've experienced in their environment from their parents is not accurate. It's just not. So I know that he mentions that it's actually a stress gene that gets genetically passed down from the parents. And then because of epigenetics, then the environment exacerbates it and then they have ADHD. It's not 100% of the cases accurate. I love Dr. Mate. I believe in a lot of his trauma work, but it's not a black and white picture. I spoke to Dr. Hallowell about that. It's very genetic.
What would you tell to parents who are listening to us and who still have trouble with accepting the label in some way that they have to put on the children, head, and who have trouble with that? Because we all want to have normal kids. I mean, exceptional kids, gifted kids, it sounds so good when it's, about, I don't know, extraordinary piano performance. And we're all happy to have, gifted child or an exceptional child. But when it comes down to those kind of things, usually it's harder to accept that.
I would say for the parents to get into their own support group with other parents who have children with ADHD, or to, talk to parents who have older kids with ADHD and look at what, the outcome of their ADHD has been throughout life. Read Smart But Scattered is a wonderful book for parents to read more about their child. Again, they could be very smart, they're just scattered. So if we work with that, they can thrive. They really can. So I understand that labels don't have to be everything. They don't have to define us. ADHD has all these different symptoms. So no two people, if you have ADHD and I have ADHD, we're not going to necessarily act the same way.
Mm-hmm.
So let's treat the symptoms. Let's manage the symptoms. ADHD, having that diagnosis, what that really does is help your child get the proper accommodations and services that help them level the playing field at school. It also can help them in the work environment, should they receive accommodations. And it will also help them understand that they're not alone. It's not a function of them not trying hard enough. They have something that they have to work extra hard to manage. So again, the label is just for awareness, because nothing can really change without awareness first. You don't have to identify as ADHD to get the benefits of having ADHD and working to manage the symptoms. You don't have to introduce yourself and say, "Hi, I'm Brooke and I have ADHD." It's just a part of me and I work with it. I also have anxiety. And I also think that back in the day, I was just watching The Marvelous Maisel. I love that show.
Me too.
I think
the third one. Yeah.
I think the fifth season.
Oh,
the fifth and final season.
Okay.
And they said, I'm not spoiling anything, but Midge's son has anxiety about sleeping in his own bed. So they take him to a therapist, and the therapist gives him tools to progressively get back into his bed. So take 2 feet closer to your bed, 2 feet closer to your bed, rather than just throwing him into his bed, right? And Midge's parents are like, he doesn't need some shrink to help him with that. That's weak. So I think that there was this mindset years ago that hide if you're different. You don't want to be different. But luckily, we live in a world where more people are accepting of different things. And pretty much everyone has strengths and weaknesses. So even if you don't have a label, you still might deal with anxiety every now and then, right? You might deal with depression every now and then. You might deal with, whatever. So we have to work and meet the person where they are. ADHD is not going to tell you what your child's life is going to be like. It's not having that diagnosis. It's how do we deal with the symptoms that he or she is exhibiting right now? And then in a year from now, how do we work with the symptoms that he's exhibiting then? And is he happy? Is she happy? Great. Is she confident? Great. Are they doing what they want to do and thriving in that? Great. That's all that matters, right? We just want a happy, safe, and healthy child.
I love the way that you present it, that the label brings awareness. So just we maybe pay attention a little bit more to some, areas of their lives. But when we deal in any particular situation with that particular child in that moment and see what's happening there.
Yes. And you brought up Dr. Mate. He on my podcast was saying ADHD is not an explanation. It's a description, right? So deal with the symptoms.
Exactly. Can you tell where people can find you? Because I know you're offering coaching programs and maybe even support groups for parents. So please do tell us where we can find you.
Absolutely. Coaching, COACHING, with Brooke with an E. So coaching, WITHBROOKE. You can find me on all social media platforms. We're pretty big on Instagram and Facebook. We have bite-sized tools and tips that we share with our community on a daily basis. And we also have a newsletter where we share those tools too on our website. Bunch of freebies for students. Student starter pack to help them get ready for the school year with ADHD. So if you explore our website on coachingwithbrooke.com, lots of good stuff there. Anywhere on social media. And you could also visit my podcast, Successful with 2 L's, with ADHD.
Thank you. Thank you, Brooke. I'm very grateful.
Thank you for having me. I so appreciate your time and what the message that you're sending to everyone.